A soccer player is tackled from behind and drops to the ground grabbing at his leg. There is an obvious deformity and he is screaming in pain. What would you do? In this video, you will learn a step-by-step treatment of a broken leg patient. Hope it will help you deal with such scenarios. The first step is to reduce the danger of further injury. You should stop the soccer game immediately. Then, keep the patient's leg still until help arrives. Remove any foreign objects from the leg and manage bleeding if there is any. In order to reduce the swelling, you should set the patient's leg higher and get an ice pack wrapped in a towel to ease it. Look for any other injuries that need attention. It is important to make sure the patient is resting in a safe and comfortable position. You should also try to make the patient calm down and minimize his or her panic. The second step is to decide the patient's level of consciousness. Ask the casualty the 4 CAS questions. C for can you hear me, O for open your eyes, W for what's your name, and S for squeeze my hand. Calm the patient to have a better chance of getting an answer from him or her. If the patient is not conscious, set him or her in the recovery position. There is more information about the recovery position in the doctor's ABCD section and video. The third step is to get help or call an ambulance. Call 000 for an ambulance or ask somebody else to make the call. Make sure only one person is given the task of calling, because staying organized is a priority in these first aid situations. A large crowd approaching the telephone is highly inefficient. Clearly describe the situation of the patient to the doctors of the ambulance so they can get prepared. Follow any instructions given by the doctors of the ambulance if applicable. Use a stick, the good leg, or any other hard object available to splint the broken leg before moving the patient into or out of the ambulance to avoid further injury. Some processes must be left to professionals. Do not attempt to realign bone if you are not a professional. This step can happen simultaneously with some of the other steps. The fourth step is to check the patient's airways and manage breathing. Remove any foreign object in the patient's airway so they can breathe properly. Remove any clothing or equipment that would make the patient's breathing difficult. Put their mouths facing up so that they can breathe with less fatigue. Do not let the patient eat anything until a doctor confirms, as a broken leg often needs surgery and foods can cause suffocation during operations. Check for signs of life and start CPR and apply defibrillation if needed. See the doctor's ABCD for more details about CPR and defibrillation. Now let's look at the treatment after the patient arrives at the hospital. Radiology examinations such as X-ray, CT, and MRI are normally needed to assess the type of broken leg and to decide further treatment. An incomplete fracture is when the bone is cracked but has not separated. A complete fracture is when the bone has snapped into 2 parts or more. A closed fracture is when the skin is intact. An open fracture is when the bone has gone through the skin and is showing from the outside. When treating the broken leg, doctors will set the leg using a splint. Immobilization using a splint or cast is important to let the leg heal. Canes, crutches, and wheelchairs can assist the patient in moving around easier while still letting the leg heal. Sometimes surgery is needed. Equipment and methods used in surgeries include pins, screws, metal plates, and wires. Metal rods are specifically used for injuries in the middle part of the thigh. Some sort of object can be used for elevation. Medications include different kinds of painkillers. The strength of the painkillers used depends on the amount of pain experienced. Medicine related to surgeries often include antibiotics. The treatment after hospital includes physiotherapy and exercise which allow faster healing and reduce permanent disability. Psychological supportive therapy can also be important to some patients. Limited movement and rehabilitation are often needed as well. In order to make the patient feel more comfortable during the above process, you need to make sure the patient is always in a safe and comfortable position. Make the patient calm down and minimize his or her panic. Follow all the treatment procedures mentioned earlier to reduce further injury and pain. Use painkillers according to their levels of pain. Canes, crutches, and wheelchair assist moving around easily while still letting the leg heal. Give the patient psychological support throughout the process. Last and most importantly, get professional help or care when able to, and do not trust yourself or others if you or them have limited or no knowledge within the field. Hope you know how to treat a broken leg now. Safe game and thank you for watching this video.